positioning yourself as a market leader in your community. So what services are you providing that others aren't providing? What outcomes are you getting? What is your cost data? What is your staff qualifications?
Well, thanks for doing this, Robbie. Let's just dive right in. What are the most common challenges physical therapists face when negotiating contracts with insurance companies that you've experienced?
Yeah, so when you're negotiating insurance contracts, you are doing so in a very local and regional way, right? So you need to know who the big payers are in your markets, who you want to be in network with, and you need to take your time and read things carefully. So I think one of the biggest challenges is folks think that they need to sign every contract that comes across their desk, and they don't need to do that. They need to take the time to know their cost per visit, to know what the reimbursement is, and to know all the other pieces that are included in that contract, which can trip them up. So I would say one of the biggest things is for people to take the time to do their homework and not just sign everything that comes across their desk.
Got it. Great. And how do you advise physical therapy practices on effectively communicating their value proposition during contract negotiations?
Yeah, so one of the things that you want to be able to do is have a face-to-face conversation, if at all possible. So find out who your provider rep is for that particular payer, and then ask for an in-person meeting. So that can happen, you can do that, and then be prepared to present your outcomes and your data for the patient population that you treat. So for example, do you treat total knee patients in X number of visits with this kind of outcome compared to the national norms? Then your value proposition is that you're going to cost that entity less, even though they pay you more per visit, right? So don't just go into a contract negotiation saying, oh, we provide great care. Everybody says they provide great care. Prove it, right? And what a payer cares about is not only they care about outcome, they care about patient satisfaction, and they care about total cost. So go into those conversations with that understanding of what they're looking for.
Perfect. Okay, so insurance companies don't always like to pay more. How do you approach negotiations with insurance companies that may be resistant to certain reimbursement rates or coverage terms for physical therapy services?
Yeah, so nobody wants to pay us more, right? So we have to go to the table with data. We have to go to the table of what we bring to a market that's unique. And so a couple of your negotiating pieces are, for example, let's say you're the only private practice in a market and all the other access is hospital-based practices, right? So go to the table understanding what that difference is and that you provide an access that they need, right? So understand what your market share is and understand what they need. So payers need multitudes of providers to provide services in order to give their consumers choice, and consumers want choice. So understand where your market position is and use your market position, if you have one, to go to the table to ask for more money. The other thing is, know what you're asking for, right? So if I'm getting paid X amount per visit, what do you want? Do you want $5 more? Do you want $10 more? Yeah, we'd all like to have 50% more. You're not going to get it, right? So go to the table and ask for incremental change. And it's kind of like buying a car. Ask for more than you want and negotiate, right? So, but don't go so far above what the market is in your community that they're just going to say, we're not going to talk to you.
Right. So does this work? Can you provide examples of successful negotiations that you've done?
Yeah, it does work. And so I think one of the things that folks have is just the misunderstanding that you're never going to get a raise, right? No matter what you do, you're never going to get a raise. So here's your strategy. So whatever time of the year, pick a good time of the year that you're not swamped with other things, which is probably never, but probably not January or December, right? So pick June. And that's insurance contract negotiation month. And you're going to go to the table. So find your provider rep for every payer. They don't want to read epistles, so you've got to write a short letter. What your cost, change has been, what your market looks like, what you're asking for, and you go to the table every single year and ask for a raise. Don't just assume that you're not going to get it, right? And with some background information, what's the cost of business? What's the cost of inflation in your market? What's the changes been? And go and ask for those changes. And you might be surprised. So I have seen in the last 3 years, especially the last 2 years since COVID, we have seen payers, big giant payers in markets that have not given raises in the past, begin to move incrementally on the fee schedule. Not huge changes, but $1, $2, in a visit or per unit. So those small changes are impactful. So go to the table and ask. But the best way to ask is make sure you get to a real person to ask the question to, because if you're just throwing an email out there into the general email land, you're not going to get anywhere.
Right. That's really helpful. Doesn't always work. In your experience, what are some common mistakes that PT practices make during contract negotiations with insurance companies?
Yeah, so it's more than just the fee schedule, right? So when you get a contract, one of the things that I think people make mistakes on is not reading all the contract. And so the private practice section of the APTA has a great insurance resource for members about language that is good for the provider or good for the payer versus good for the provider. So you want to look at that before you sign any contract, but understand what you're signing. For example, you might be signing a contract that has a bunch of additional products inserted into it, like workers' comp products that you really don't want, right? So don't just sign on the line and accept all the terms of that agreement. Make sure that you know what you want. Or maybe you're signing a contract and you think it includes all their products and it just includes their PPO, not their HMO. So make sure that you understand what products that you're getting. Also, make sure that you understand what are the terms of that agreement. How do you get out of it, right? How do you terminate it? How do you, if you don't like it, what's your out, right? How are they going to notify you of essential changes to that contract? Most people don't understand that when you sign one of those contracts, it says you're actually going to check the benefits and make sure that you're following the patient's insurance plan and notifying them of anything that's not covered. So I see consent forms frequently that say, we're doing this as a courtesy. Well, it's not a courtesy because in your contract it said you would do that. So all those terms that are included in the contract are important in addition to the fee schedule. So people just look at the fee schedule and sign it and don't understand that all the different terms also impact their administrative burden and, what work is required to work within that system.
Right. And that resource is available to anyone with an APTA sign-in, right? Because it's on the State Payer Advocacy Resource Center, or SPARC, which is a joint APTA and private practice section. So AOPT members, for instance, can receive that resource too, or at least access it. And we can maybe put up the URL for it. Yep. Okay, great. So a lot of folks that I speak with are smaller, and they think they have no negotiation leverage. What strategies or tactics do you use to leverage negotiation power on behalf of PT practices when dealing with insurance companies if they're small?
Yeah, so if you're small, are you providing a niche practice that's not easily accessible? Some of those include pelvic health. That's a key one that needs access, or people need access to, but they don't have access to. Pediatrics is another that people don't have access to. Neuro rehab, outpatient neuro rehab is another one. Now, if you're doing outpatient orthopedics and you're the small guy in your community, and there's lots of big players in the market, right? Or there's lots of private practices, don't just make an assumption that you're not going to get a raise, right? Because we don't really know what all the formulas they use to make decisions. But sometimes it's better for them to give you a raise than the big guy down the street who, if they give them a raise, they're giving, weight more, right? So don't make assumptions that because you're small or you're a small piece of the market that you don't have negotiating power, right? So if you never ask a question, you will always get the same answer, right? So ask the question and be the squeaky wheel. I do believe sometimes the squeaky wheel gets the grease, and so you just got to keep being persistent.
Mm-hmm. Okay, that's great.
Not annoying, but persistent.
Sure, exactly. Yeah, it can get frustrating, I'm sure. When crafting contract proposals for physical therapy practices, what key elements do you prioritize to ensure favorable terms and conditions with insurance companies?
Yeah, so like I said, it's more than just the fee schedule, right? So what you want to look for are things that are very burdensome. So prior authorization requirements, having to use third-party utilization management fees. A lot of people sign their contracts and don't understand that their contract says, I'm going to be beholden to everything that you put on your website, all the policy manuals, all the payer policies, all of those things. So they just make this generic statement that you'll follow all their manuals that they put on the website. And I would suggest they go back to the table and say, I want you to give me a list of all those things that I am responsible for. Or put that in your contract instead of just agreeing to anything they can think of in the next 15 years, right? So those are really key items that you need to read. And if you don't read legal language very well, then ask for help. Get your attorney to help you because you might be signing something that you shouldn't be signing and agreeing to terms that you shouldn't be agreeing to. So, if you read that contract and it reads like Greek to you, get help because you don't want to be signing things you don't understand.
Right. Well, so this is a quickly moving area. Can you discuss any emerging trends or changes in the landscape of insurance contracting, such as value-based care, and how a practice can adapt their negotiation strategies as a result of those changes?
Yeah. So we have more research than we've ever had that shows the cost effectiveness of physical therapy, and especially physical therapy first, right? So I think when you go to the table, you want to have those resources and references readily available, right? Have them in your proposal, have them at your fingertips to show the difference in cost. Low back pain, for example, tons of research, and we're actually seeing some payers understand that the value of therapy first for back pain versus going to see a physician, getting a bunch of tests or potentially surgery, that sort of thing. So have those references readily available so that you can speak to that, body of literature, but also understand what your outcomes are for that patient population. So if I'm going to reference this back pain literature, I need to be able to say, this is how many visits our back pain patients typically take. This is what outcomes we get. This is our patient satisfaction. This is our net promoter score for this patient population. This is the average cost per episode of care for this payer for that particular patient population, and then compare that to MRI, surgery, etc. So I think, if you do your homework ahead of time, you've got much more of a value proposition to propose. We still don't have payers paying us for value versus volume necessarily, but we can certainly bring the data to the table, and I think that's the critical piece.
Beautiful. Okay. And then just finally, what advice do you have for PT practices seeking to improve their negotiating position and outcomes when dealing with insurance companies for contract agreements?
Yeah, so positioning yourself as a market leader in your community. So what services are you providing that others aren't providing? What outcomes are you getting? What is your cost data? What is your staff qualification? So when I've gone to the table to negotiate, first of all, I like to get in-person meetings because I'm much more fun in person. But to have that conversation face-to-face and to have a very short deck of information, remember that, you're not going to have long to make your case of what our staff qualifications are, what our outcomes are, what patient populations we treat, what our specialty areas are, and how we compare to our market in our community. And that really resonates because, again, they want to improve outcomes and reduce costs. That's their goal. And they don't want to have unhappy patients, and they want their patients to be happy with the access that they have. So understanding the position they come from, go to the table with those thoughts and ideas.
Beautiful. Awesome. That's great, Robbie. Thank you so much. Go ahead.
One of the challenges that therapists have is that they get a contract on their desk that they didn't ask for, right? So it just pops in their mail and it comes to them and they think, oh great, somebody wants to be in network with me. I must be doing a great job. And I would say be suspicious, because I call those fishing expeditions, because a lot of times payers are coming to a market, and a lot of times these are workers' comp managed care payers, and they're trying to come to a market, and in order for them to come to that market and sell their product to an industry person that's buying a workers' comp product, they have to have enough providers that have agreed to take their product in order to be in that market. And so they send you this contract and tell you how great you are, and you get flattered, and you look at the terms and you're like, oh, that's a good fee schedule, I'm gonna sign that. Well, don't do that. Never sign a contract without negotiating, right? Never take anybody's first price. So you need to look at and ask them hard questions. What employers do you have in my market? What entities are you currently insuring? How many covered lives does that look like in the counties that I serve? So push back, ask some questions. If a insurance contract shows up on your desk that you didn't ask for, they need you more than you need them, right? So don't just sign it and be happy about it. Negotiate.